So I'd like to draw this session towards an end, and I'm about to call on Professor Gumley to present the poster prizes. And thank you very much to Rory and Professor Alan Carson for those fantastic talks. Thank you.
Thank you very much, Donald. So look, we've spent the day here in the Royal College of Physicians in Edinburgh, and it's brought so many memories back to me of previous meetings here where, rather than 15 to 20 of us here today, we've had maybe a couple of hundred people here today, and I'm very much looking forward to the 14th annual scientific meeting, and hopefully we'll see you all face to face. It falls to me to do a number of things. First of all, I want to thank all of our speakers today in creating such a stimulating and thought-provoking meeting. For me, speaking personally, during the height of the COVID pandemic and all the associated lockdowns, it really seemed like, and I think science really came to the fore. And it came to the fore, and that was reflected in the progress that was made in vaccinations, but also the huge progress that science and research made in terms of public health and public health advice, but also, as we've heard today, mental health research and public mental health research. And what that really shows is that where the public interest is behind and kind of prioritizes producing scientific evidence, we can really science can really deliver in the interests of the public and public health and public mental health priorities. And I think there's an important learning for us going forward in terms of how we do science and how we conduct science. We've also learned, I think, as well, the importance of a kind of broad stakeholder involvement in research, and in particular involving communities in helping determine and shape the questions, shape the priorities for research, but also acting as co-producers in that research. We've also learned the importance of having access to data, having access to up-to-date data, and that was very strongly reflected in Vaughan Bell's and Dorothy Wade's living metasynthesis. But they raised the importance of how much research they could not include in that, and how much evidence was missing from that very significant piece of ongoing work. And that underpins a real need for open, transparent, and reproducible science that's available in a kind of public way. I also felt like I learned during COVID-19. I had the honour to chair the Mental Health Research Advisory Group, and in my experience there was policymakers, scientists, researchers, clinicians, research funders, people with lived experience. We came together and we really progressed very quickly how we took and understood the evidence that was emerging at that time and how we translated that for policy in a Scottish context. And I think there's much to learn about that as a model going forward. And we've heard today about important areas for future research. We've heard about the importance of long COVID, and we're only beginning to understand long COVID, and the recent CSO funding call to fund research into this area is an important step forward. Similarly, we've heard today a range of critical priorities for policy and practice and research. And for example, implementing the mental health law review will also need a sustained and funded research. And there are models there that we can think about to make that happen and to translate research and findings responsibly, but also swiftly into policy. So I think now I turn to the most important act of the day, before closing things, is to our posters. This year, all of our judges, Donald, Susie, Ashley, joined by myself, we were all highly impressed by the standard of the posters and the presentations this year. We were impressed by the variety of studies and the productivity of students, researchers, clinicians doing research during the pandemic. However, we had to choose some winners, and this wasn't an easy task. And I have to say, all our winners will receive a £50 book voucher, and I've got a nod. Amazon book voucher. So our first winner, I'm very glad to say, is for his poster on poverty, stigma, mental health and well-being, a review and synthesis of quantitative and qualitative studies. Our congratulations go to Greg Inglis. Our second winner today, our student prize, was a tough competition, but we chose in the end a poster investigating the impact of viewing before and after body images online. So congratulations to Ellen Flynn. And finally, our People's Choice Award. And that, we're very pleased to say, goes to a PhD student from the University of Glasgow, conducting her research on social mental health reconstruction via digital interactions amongst South African youths living with HIV. So congratulations go to Sung Ha An for winning the People's Choice Poster Prize. So thank you very much. Congratulations to all our poster presenters this year, and congratulations especially to the winners. A sincere thanks to everybody in the network who has worked tirelessly to put together our annual scientific meeting, and special thanks to Donald, to Lisa, to Kathy, to Ashley for all your support today in organising, and for all the members of the team who are also here today providing support to the day. The last thing for me to say is I very much look forward to hopefully meeting everybody face to face next year for our 14th annual scientific meeting. So thank you, and enjoy the rest of your day.